Hi, this is Dr. Shekar Reddy, taking care of NICUs, complicated pregnancies, perinatal medicine.
See, this is just an explanation for the initial few 5 to 10 minutes. We'll be taking care of these things. See, if suppose a person is getting hanged himself, a person who is intentionally want to get suicide and then he is suiciding, he is about to suicide, and then what is happening here? And this is simple slides that we are showing. Is the acute hypoxia. What happens in the acute hypoxia? See, by 2 minutes, the tightening of nose is tightening, and then followed by that there is a pain, breathing difficulty, and there is an oxygen shortage. Then he will start wiggling, and then followed by that there is an attempt to remove the nose. Though he decided, but still there is an attempt to remove the nose, and followed by there is a lividity. You can see, and followed by that there is a rapid heartbeat rise. There is an increase in the heartbeat. Followed by there is a hypertension. And then followed by that defecation. See, remember, this is not that happened here. Initially that didn't happen. There is something nose is tightening, and almost there is hypoxemia leading to hypoxia. Followed by that there is a difficulty in the lividity, and then followed by that the person is passing the motion. And followed by that urination, ejaculation, mucus plug, and there is a slow heart. Initially there is a rise in the heart rate. Sympathetic activation has happened. Blood pressure, followed by that there is a decrease in the heart rate, slowing of the heart rate, and by the 3.5 or 4 minutes the baby respiratory failure is happening, then the muscle relaxation is happening. Why this is most important we will discuss at by end of this acute hypoxic episode. And then there comes an agony, followed by that the arrest, and then followed by that the brain death, and then declared death. So these are the events that is happening, and then we are discussing. We will be little fast, nothing. If there is anywhere you need to stop, you just explain me to stop it. See, here the common catch is handling, but the way they handle is different. If the person hands like this and they don't have. See, if someone catch leg, someone catch there. So there is a thing that what we need to see, what we need to catch in these things are important. These are the definitions for these things. What is hypoxemia? The first initially the person had a hypoxemia, means there is a decrease in the blood oxygen. Hypoxia, specific parts of that. That's a hypoxic injury, hypoxic failure, hypoxic nephro. Next, anoxia, followed by that the extensive low levels of the oxygen in the body, and there comes an asphyxia, complete absence and accumulation of the carbon dioxide. Why we are saying these all things? When there is a Doppler changes, what is happening? When there is a Doppler reversal, when there is an absent Doppler, what is that? The baby is in phase. When there is a reverse Doppler, when there is an accumulation of the carbon dioxide happening, we label that as an asphyxia and not hypoxia. And this way, and where the meconium is being passed, where the motion has passed there, where the meconium is passed in the baby. So acute hypoxia, chronic hypoxia, and our panelists will explain to us where the acute, what are the different stages. But just I am giving an initial introduction for that. What is the cardiac output? What is a reserve of a person? The reserve of a person. Every body, every organ will have some reserves. And what is the reserve? Suppose the heart is there. If you run, the heart rate will rise. That is a reserve that the baby has. Our has. In most of the times when there is a distress, or when the respiratory rises. So the reserves are the most important for all the organs. The reserve of the heart is heart rate. The reserve of the respiration is respiratory. If you see a same type of X-ray film for the 6 months baby, 6 years baby, and a 60 years person, a small amount of the changes in the X-ray, here there will be retractions completely, and here there will be tachypnea, and there will be nothing. So that depends upon the reserve. So where there is a lack of the reserve, there will be retractions are happening. So reserve. What is the reserve? Cardiac output is something like a stroke volume into heart rate. What is reserve here? What we are assessing through the CTG is something like a heart rate. Heart rate we are seeing. As we go on the stroke volume, these things as a preload and the afterload, this will be explained. See, most of the slides now will be explained through this mechanism. This is considered as a baseline. Below that is a deceleration, this is an acceleration. Accelerations, baseline and change. Because when we are discussing about the CTGs and the things, acute hypoxia, we will be discussing only about the baseline, variation, and acceleration and decelerations. These are things our panelists will explain. Then just I will just explain about the contraction phase, and then we can go ahead with the what all the things with the real panel. See, if you see, this is how it appears. This is the umbilical cord. When the contraction is happening, when the contraction starts, what I explained, the cardiac output is nothing but equal to stroke volume into heart rate. When the contraction started, you understand, try to understand. When the contraction started, first thing that is got compressed is the umbilical vein. What carries in the umbilical vein is the oxygenated blood. But still the oxygen is there in the body. The baby is neither in hypoxia nor hypoxia. So circulatory wise, the volume get decreased. So when the volume is getting decreased, automatically the cardiac output is stroke volume into heart rate. Stroke volume is decreasing, so heart rate will rise. During the initial phases of the contraction, you can notice that when there is a contraction begin, there is a rise in the heart rate. Slowly, if you can see, when I am getting compressed, automatically arteries are compressed. What does arteries carry? Deoxygenated blood to the baby. Deoxygenated blood to the placenta. When the deoxygenated blood is getting stopped, so obviously the baby is in hypoxia. Hypoxic phase, automatically there will be a decrease in the heart rate. Followed by that T, whenever this is got compressed this way, and the contraction is released, first release is this, parallelly this thing. So this is how it happens. First, volume decrease, open, grossly open. And then again, when opening, this is happening. So the parallelism that happens here is when this got open, relaxation phase, the deoxygenated blood is coming to the placenta, and the placenta is ready. From the uterus, you have received a fresh blood, and the blood will flow through the umbilicus. So again, the oxygenation is increasing, so that there is a rise in the heart rate. So now we understood there is a contraction phase, initial phase, when this got contracted, heart rate has increased, completely decreased. When it is releasing, it is increasing. Okay. To happen this, the uterus during the relaxation phase should receive the placenta should receive the fresh blood. Suppose the arteries are relaxed. During the relaxation phase, this has opened now. This opened. But the uterus didn't supply the fresh blood to the placenta. So what is happening? Though this has opened, the baby still is in hypoxia. Uteroplacental insufficiency. From the uterus, the placenta is not sufficiently perfused. So when there is an uteroplacental insufficiency, the baseline, again the normal heart rate we are not receiving, it is giving late. Lately that is occurring. This is a late deceleration. This late deceleration is a sign of the uteroplacental insufficiency. And then we'll be discussing further what happens, why happens, and then complete discussion will be on these things only. So we will be discussing now about acute hypoxia, subacute hypoxia, evolving hypoxia, and sudden fetal anemia. So once you get clear picture about the contraction phases, relaxation phases, late deceleration, early acceleration, then we will start these things. So acute hypoxia. Without wasting our time, we will go ahead directly into the acute hypoxia.
We'll continue in the next session.